My name is Rafi. I am a consultant general and colorectal surgeon at Sunderland, and I'd really like to thank the organisers for allowing me to present today. And I'm going to present some tips and techniques for the FRCS in general surgery, and I've got a couple of interests. I'm faculty on the Alpine course and founder of Higher FRCS. So the exam structure is divided into two. Part 1 is taken after your ST6 ARCP, and you get 4 attempts to do it, and that's spread over 2 years. And it's comprised of 2 papers, one of 120 questions and the second is also 120 questions, and each paper is 135 minutes long, which works out to be about 67.5 seconds per question. Now that's not very long, given that you have to read the question, interpret it, and formulate an answer. Part 2 is usually done over 2 days, and you get 4 attempts over a period of 4 years. And you've got a clinical viva and an oral viva. What's important to note here is that you've got 6 years to do this whole exam, which means that you could be 4 years after your CCT date before you pass the exam, which is quite a sobering thought. Part 2 is further divided in the clinical and oral sections. So the clinical vivas, which currently doesn't have patients involved and you get given a clinical scenario, it's divided into general surgery and a specialist interest. And each of those has 3 scenarios, one which is 20 minutes and 2 which are 10 minutes. The oral vivas are comprised of 4 30-minute stations. In each station you get given 6 scenarios which are meant to last about 5 minutes. The 4 areas that they look at are emergency surgery, trauma or critical care, general surgery principles and clinical practice. That's areas such as anatomy, physiology and pathology, so they may ask you about the inguinal canal, for example. The specialist interest surgery, such as a particularly clinical practice that is relevant to your speciality, such as in colorectal they may ask you about neoadjuvant chemoradiotherapy and their protocols, and a specialist interest for basic principles and academic foundations. So they asked about embryology of the anus, and they asked me about statistics in a paper, and the paper used to be specific to your speciality, but it's actually now a more general surgical paper. So the key takeaways from both of those exams, both of the parts, is that part 1 looks at the breadth. So a question on skin is equal to a question on colorectal, and part 2 focuses on the depth of your knowledge. And it's important to realise that 50% of part 2 is your speciality. So the approach to the exam is all about structure, and I'm going to look at areas before the exam, during the exam and after the exam for both sections. So for part 1, you need to prepare yourself, because this is a grueling process and you do come out of it slightly different, because you have got a lot of things to juggle, a lot of priorities, and they're all demanding your time, and revision does take time. And you also need to prepare your family, because they are going on this journey with you and they need to understand the time commitments required to actually pass this exam. On average, speaking to people, it takes between 3 and 12 months of preparation. I've known some people who have revised for a month, and I've known people who have revised for 2 years. So there are extremes, but generally speaking, 3 to 12 months of preparation. And I would say that try not to use an attempt as a practice. just to see how things are. You should really prepare for this exam, and if you don't pass, that's okay, because you've already had that background preparation to it. And the resources, the syllabus is very important, and I know from my own experience, everyone tells you to read the syllabus, especially at ARCPs, and no one ever does, but it is actually very important. So I would look through it and familiarise yourself with it, because there are about 134 topics in that syllabus, and a question can come up from any of it, particularly in part 1. In terms of books, there's an SBAs and EMIs for general surgery. Now, the part 1 is only single best answers. And so this book was actually written before the change over from extended matching items to just SBAs. But it's still a good book and still relevant to revise from. We colloquially call it the Blue Book, but it does really represent the style of the exam as much as is possible. Then there's a second book, which is FRCS General Surgery, which has 500 single best answers, and it does have extended matching items in as well. And it's called the Green Book, or what we called it, the Green Book. And it recently got a bit of flack because people were saying that there were some inaccuracies within it, but actually it is a very good book to revise from. There are a couple of other MCQ books, but generally these are the two main ones and are probably the most reflective of the exam. So those are the ones to focus on. There are also a couple of starter courses, one by Doctors Academy, which is a 1 or 2 day course, and it is a very good a very good course, because it really focuses on the knowledge, and you do go away thinking that you've learnt a lot, and it's reasonably priced as well, so I would certainly look out for that on their website. There's also a higher FRCS tips and techniques course, which is a 3-hour intensive course looking at questions and how to answer them. The online resources are the main focus of revision, and is probably the one that you should go for first in your revision. The most commonly used one is the EFRCS, and is probably the question bank that everyone uses. It's got a good breadth and a good broad base of knowledge. Some of the questions are reflective of the exam, some of them aren't. So it's a revision tool in terms of gaining knowledge, as well as getting your brain geared to answering the style of questions. The FRCS Companion is similar to the exam, and it only focuses on single best answers, and it also has images. So this is well worth looking into, and is really becoming one of the standards in how people are revising, certainly in the last 12 months. There's a new question bank called Higher FRCS, which has got the largest question bank with over 1,000 single best answers, and again is similar to the exam. It does have some images, but there are fewer compared to FRCS Companion. The other resources that you can use are YouTube and podcasts, and speaking to candidates, the most commonly used are Behind the Knife, which is an American podcast group, but it does a really good absite review and covers all the subject areas, so HPB, esophagogastric, colorectal, and it really gives a nice summary over an hour, and you can listen to it in the car, and it's very easy to digest. So that is a very good resource. And on YouTube there's a guy who runs a podcast stroke video YouTube series called Dirty USMLE, and that really breaks very complicated topics such as cancer drugs into bite-sized chunks, which allows you to remember it. He gives good mnemonics which you can easily learn as well. One of the most overlooked things when revising for part 1 is the study group, and most people think that this is most relevant for part 2, but actually is really useful for part 1 as well, because it not only helps you go through things that you may not understand, but it also gives you that moral support on the journey. During the exam or the night before, make sure you do relax and have a good night's sleep. The exam is done at a driving centre usually, so we packed lunches because you don't really get much time between the first and the second part of the exam. And there's not much area to go and relax in between, so prepare yourself and pack a lunch and just eat it in between. And if there are other people doing the exam at the same centre, then you can meet up and just relax or run through the previous questions if you are that way inclined. Pace yourself. Read every single question. Key words such as not, least likely, most likely, or most appropriate are the words that are going to catch you out. So make sure that in your brain you are looking out for those particular words. And read the question and answer it the first time, and you can give your best answer, because it takes about 20 to 30 seconds to read the question, and so you've not got much time to answer it. So actually, if you just guess at it and don't really give it your full thought when answering, then you don't really get much time to go back at it at the end. So although there are, on the computer system when you're doing the exam, there's an area where you can flag the question, in truth most people get about 5 to 10 minutes only at the end to review your questions. After the exam, enjoy the period between the exam and the results, because you can't really do much about the outcome now. Read a bit intermittently because you don't want to lose all your knowledge. And the reason for this is because that knowledge is going to be useful for part 2. I would recommend spending a bit of time with family and friends, and also work, because these are relationships that, whether we really like it or not, do suffer during this process, both at home and at work. And so it does benefit you to just spend a bit of time trying to rebuild those in between, because after 3 months you're going to need to get their understanding before taking part 2 as well. For part 2, the resources are mainly the courses, and I would recommend everyone to go on at least one of these courses. I went on 2. I went on 3. I went on the Alpine course, the Whips Cross, and the Phoenix course, all 3 of which were really good. And I actually went on the Whips Cross course before part 1, which gave me a lot of knowledge beforehand. So these courses aren't exclusively for part 2, but they may help for part 1, but they are obviously geared towards vivering and exam practice for the part 2 specifically. Create a study group. Practice with anyone and everyone. SHOs, other registrars, consultants, anaesthetists, everyone. And also the podcasts behind the knife, because they are in the format of a viva, it's quite nice to see how they answer the specific questions. Books to use. I would say that for part 2, the companion series is very useful. So in particular, the emergency and core book and the speciality book, because it gives you that depth that you really do need to pass the exam. The Viva books are Cracking the FRCS and FRCS companion cases. Most of the people that I was revising with bought both books. They do cover similar areas, but they do give you slightly different ways of answering it, and it is useful to get both. I used both. I particularly focused on one and then supplemented it with the other. So you can do it that way, or memorize or focus on both. There's also an online format for revision called FRCSviva.com, and that is again a useful way of revising for the exam and getting new questions and approaching the answer. And when you're doing these books, and certainly the online version as well, you have to remember that these obviously may or may not be the questions that you're asked, but you're looking for the style. So once you've answered the questions in the books, think about other areas of what they might ask, and it's going to be common things, but they're going to go into detail. So the management of rectal cancer, T1, T2, T3A, T3C, things like breast cancers, when you use trastuzumab, when you use pertuzumab, things like that, and you know, the use of aromatase inhibitors. So really think about your topic and see if you can mirror the questioning according to different areas that come up. Sometimes they do ask uncommon questions that you really don't know the answer to. Generally, don't try and blag it. Just say pass, or I'd like to move on, and they do move on. They're trying to pass you, and they're looking for you to get the marks. So they'd rather you say I don't know and then move on, or pass and move on, rather than focusing on an area that you don't know about. During the exam, this is very individual, but stay close to the exam venue. You don't want to be late, and you don't want to oversleep. And if people know that you're in the hotel or the venue, then they can come and knock on the door. When I did the exam, there was one person that didn't turn up, and actually someone went and knocked on the door and got them down, and so they didn't miss the exam. And that can happen to the best of us. So that's important. But if you're the type of person that really just needs to be away from everyone, then that's also fair enough. I would recommend you practice and learn with friends until the last day, but rest the night before, because it is a long day, and I did notice a drop in my performance towards the end of the exam compared to the beginning. Also, before you answer the question, make sure you've understood the question, and it's okay to repeat, but if you don't understand it after the second time, then I would caution you against asking for another repeat. Just say pass, or just attempt an answer, and if it's not quite the right track, they will direct you to the right track, or they will say that thank you, but what about this, for example. I had an examiner on the day that I really didn't understand what he was saying, and I answered a question, and then he brought me onto track. He asked me the same question but in a different way, and then I answered that way. So just be wary of that. The key is structure. They are looking for a day one consultant. So use the word I. So I would perform a laparotomy, or I would organise investigations, and have the right knowledge, but they are looking for a logical train of thought, a structured train of thought. And if they see that and the knowledge is relevant, then generally you won't have a problem. It's when you start saying or jumping from examination to investigation that things then become tricky and you start to struggle. So start with an opening, sensible message, and These include things like I would personally go and review the patient myself, or I would take a full history and examination, in particular focusing on red flag symptoms. And you move from an MRCS to FRCS level of knowledge and structure. And the longer you keep talking, the better it is, as long as you're progressing in your thought and the depth of knowledge. And if you finish an answer, they will progress you to more in-depth questions and challenge you. They'll ask you for evidence, and that will get you to a level 7 or 8. In the exam, a 6 is a pass, and a 5 is a borderline fail. So in the scenarios, you get 6 scenarios per 30-minute station. In the first scenario, if you get a 6, that's a pass, but you might get a 5 in the next one. The next one you may get a 7, and that cancels out the 5. So if you don't do very well in the first question that they ask, carry on, don't let it faze you, because you can make up for it afterwards. The key is focusing on the next question if you don't do very well on the things that you don't know about. And as I mentioned, the progression and your performance will decline over the day. That's natural. So when you start the Viva or the clinical, aim to make sure that the first few stations are completely spot on, that you are completely on the ball when you're answering the questions, because it's likely that towards the end of the day you may make human slip-ups or errors, or start to say something, or maybe misunderstand something slightly differently. For the academic paper, everyone gets frightened of this one, but actually it's just important to have a structure. You don't need to know in-depth statistics, but you need to know the basics, and you need to know how to interpret them. But don't blag. And if you say something completely wrong, they do give you a chance to change your mind, because they are looking to pass you. And that's important. They are consultant colleagues on the other end of your table, and they are treating you like a day one consultant. So don't be scared of that process or the fact that people are quizzing you. You are equals on that table, and you are just really there to prove that you can do the job at the end of it. After the exam, so relax and take a break. Have a contingency if you don't pass, and don't completely lose the momentum. Just really maybe do half an hour or even 15 minutes a week to keep your brain ticking, because people do forget very quickly after the exam. So if you don't pass, which I hope everyone will, but if you don't pass, then you don't want to be starting from complete scratch. So that is what I would really recommend you to do. I really hope that that's been useful. It's been a very short presentation, and I really hope that everyone will pass. It is a grueling process, and I can only hope that everyone gets a study group and does really well in the exam. Good luck, everyone.